Safe staffing saves lives. That's a message from local nurses who say being short-staffed is related to violence in their workplace.
Yeah, did you see this above the fold last week, cover of the Philadelphia Inquirer? The headline, look at that headline. Nurses sound alarm on attacks. These are physical attacks.
So to help us understand what's at stake and what exactly they're dealing with, we have registered nurse Stephanie Stuka from the Albert Einstein Medical Center.
She's also a member at large on the board of Einstein Nurses United, the hospital's chapter of the Pennsylvania Association of Staff Nurses and Allied Professionals. Well, let's go through this a little bit. What kind of attacks are we talking about? Physical attacks.
Physical attacks,
at
correct.
The hospital.
Correct. Yes. So we've had everything from nurses, also our techs. We had one who had a finger bit off that was not able to be reattached. We've had nurses' faces bashed in to the point where they've needed reconstructive surgery.
What?
I've myself seen a tech, she bent down to get something on the floor and the patient interlaced her fingers in between her hair and started bashing her head.
Banging her head.
Mm-hmm, I've seen that.
Sexual assaults?
Yes, we've had sexual assaults, inappropriate groping, ask of sexual favors. We've had
attempted rape.
Yeah, an attempted rape, yeah.
And then, as we have them listed here, carjackings?
Yes, that was in the parking lot that we had a carjacking, yes.
At gunpoint.
Yeah,
Nurses punched in the face.
Mm-hmm, mm-hmm. I had another nurse who had, the family member had threatened to punch out all of her teeth simply because we were unable to refrigerate some popsicles for the patient.
And these are the patients and the patient's families?
Patients' families, you know, there's a lot of that.
Why is there an uptick, or has this been going on all along?
There's always been an element of, you know, if patients are confused, they might come after you and things like that. But there's definitely been an uptick post-COVID. And I think just the general tone of our culture now, that it's been, people are more stressed. So, and then in the hospital, if you're in the hospital, you have a loved one in the hospital, you yourself are stressed and not at your best. And then we don't ever have enough staff. So then those two things meet and it's just an explosive situation.
And that's what I was about to ask next. The connection between this and being understaffed. Mm-hmm. What would the difference be if you were fully staffed?
So when you get to be fully staffed, everyone gets the care that they deserved. Mm-hmm. Nurses are less stressed out, and then patients feel safe. Those two things are directly connected. So that way nurses have the time to actually really focus and to hopefully be able to diffuse situations. Patients feel safer and better cared for, and also family members are feeling that they're getting the support that they need for their loved ones as well.
There's not enough staff. People don't want to be nurses?
People don't want to be nurses anymore because you get your face bashed in. Do you know what I'm saying?
Pretty simple.
Yeah, and then there's a host of other reasons as well. But what we would really like to see is there's in the Pennsylvania State House is that there is a bill put forth called the Patient Safety Act.
There you go.
And we'd really like it to be able to pass, because that would require ratios throughout the whole state, where based on your acuity, you would have X number of nurses to X number of patients. And that way nurses aren't overwhelmed and overloaded, and that everyone can feel safe and provided for, and nurses can give the care that they can feel proud of.
Do you feel that Einstein itself has done enough? Do you feel supported? Are they?
No, not all the time. The existing security guards are wonderful. They're doing the best they can with their limited resources. But when we take this information to management, we do hear a lot like, oh, okay, we hear you. But then we don't see a lot of timely results. So we do need more security guards. I don't even, we get maybe one. But we know we need them at every single entrance.
We did hear from Einstein.
Yeah.
Jefferson Health, which operates Einstein, told us in a statement that the safety and security of our staff, patients, and visitors is of paramount importance. Workplace violence is a national issue that impacts all. Jefferson is committed to supporting our employees and has instituted numerous improvements based on input from clinical staff, and will continue to do so, that enhance the safety of all our facilities. Would you agree with any of that?
I think that they set up committees, but I would like to see more security guards at each entrance, metal detectors, really basic things to help diffuse the situation and help to so that they can respond quicker when there is an incident, because there's not enough of them.
So what will it come to? I mean, More meetings, more conversations, trying to.
Hopefully, it will come to that bill passing. So I suggest everyone call their local PA representative to get that bill passed. And hopefully that when we go through our contract negotiations, they will listen to us, that we're
when will that
actively
be?
doing that. We're actively doing that.
Okay.
We're actively going through contract negotiations. And that it will be a more meaty response than just another committee.
Right.
Action.
Yeah,
Action.
actual action in a timely fashion. Like,
I had no idea it was such a scary place to go to work.
and then it's hard, you know, you're trying to assess somebody, but then you're also your own flight or, yeah, you're trying to help somebody else, but you're
You're
also
trying to
worried about
save
yourself.
lives and also your own.
Your own.
Sounds like at
Yeah.
the same time.
Yeah.
All right, hang in there.
All right, thank you.
Thank you.